So the state of Minnesota hit a grim milestone this week. 15,000 Minnesotans have now died as a result of COVID-19. And while the number of people dying from COVID has slowed down considerably, this virus is still very much here. In fact, you probably know someone who has COVID right now or has recently had it. And that uptick, along with the rollout of new vaccines and free at-home tests all of a sudden, has led people to ask some questions. So Kent, you went after a lot of these questions tonight for us. What'd you find out?
Well, Jenna, let's start with where we stand right now. The U of M updated its dashboard today. They do it once a week. And there was another slight increase in COVID circulating in the wastewater. You can see it right there, but it's still at very low levels, even compared to back in January and February. Hospitalizations, by the way, are also still very low. And in our region, new hospitalized cases actually fell from 98 last week to 89 this week. At greatest risk, of course, of hospitalizations are those with pre-existing conditions, especially the very youngest and oldest Minnesotans. And new booster shots for those groups have prompted some questions. The biggest question has come from parents of young children who previously received Pfizer's pediatric vaccine, who have now, they're having all kinds of problems finding it, they tell us. In response, we've gotten the question of whether or not they should give their young child the booster from Moderna instead. It turns out the answer is a little complicated.
The recommendation is to keep to the same product right now. And that's because we don't have very specific information that proves that the vaccine is effective in kids when you do the mix and match.
According to MDH, who you just heard from there, mixing boosters has been common for adults for a couple of years now. And MDH and CDC report that it's both safe and effective. And so, if your provider doesn't have Pfizer in stock, MDH is telling parents and pediatricians that they can use a different brand.
Really, it depends on the urgency the parent feels. Some parents really want to get their child vaccinated right away, and they should take the opportunity to go wherever there is a product available. And for parents who are a little nervous about the fact that we don't have all that data, there probably will be some Pfizer vaccine coming in.
Probably. But here's the thing, even if more Pfizer doses are coming, MDH is no longer involved with distribution because the public health emergency has ended. That means they simply have no way to track where those doses are going. The new distribution system also led to issues for some nursing homes. MDH says a few large pharmacies have scaled back on their on-site COVID booster clinics, prioritizing their own distribution first. And she says that's led some homes reporting delays in getting vaccines to at-risk residents.
We're aware of the problem. We're having conversations, but I don't know if there has been a resolution yet. But the nursing at home organizations are working with us to find solutions.
Some good news on that front. I did some checking today, and it seems like the issue is already being worked out on many levels. For example, Good Samaritan Society, which has many homes in Minnesota, told me today that they were able to take action and set up on-site clinics that will start next week, Jana. So maybe a couple of weeks behind schedule, but they're getting those out there.
You've been covering this for 3 years now. It seems like each time this happens, there's a new set of questions that keeps coming up.
Well, yeah, because I mean, if you're getting a booster and then you're not sure, you're hearing, again, it gets confusing, especially if you're a parent of a young child. And again, right now they're saying if you can hold off and get the one that, you got from the beginning, that's preferable. But talk to your doctor if not, and they think take advantage of the window while you have it.
All right, thanks so much, Kent.